The day we brought our first baby home from the hospital, I stared at him and thought, now what? I'm a doctor. I've delivered hundreds of babies, and I still felt completely unprepared to take care of my own newborn. Today, I'm sharing everything you need to know about caring for a newborn in the first month: feeding, sleeping, diaper changes, bathing, and when to call the doctor. Because knowing what to expect can turn that overwhelming feeling into confidence. Hey everyone, I'm Diana, and welcome back to Sweet Pregnant. I'm a doctor specializing in women's health, and I'm a mom of 3. And here's what I want you to know. Every single parent feels overwhelmed when they bring their baby home. Even doctors, even people who've done this before. Newborns are tiny, fragile-seeming creatures who communicate only by crying. It's normal to feel scared or uncertain, but here's the good news. Babies are actually more resilient than they seem, and you don't need to know everything perfectly. You just need to know the basics. So today, I'm walking you through newborn care, step by step. What they need, what's normal, and what requires a call to your pediatrician. Let's start with the most important thing: feeding. Whether you're breastfeeding, formula feeding, or doing a combination, feeding is going to dominate your life for the first few weeks. How often should you feed your newborn? Newborns eat frequently. We're talking every 2 to 3 hours, around the clock. That means 8 to 12 feedings in a 24-hour period. Yes, even at night. Yes, it's exhausting. But newborns have tiny stomachs and they need to eat frequently to grow and stay hydrated. If you're breastfeeding, feed on demand. When your baby shows hunger cues like rooting, sucking on their hands, or getting fussy, offer the breast. A typical nursing session lasts about 20 to 40 minutes, though some babies are faster and some are slower. Make sure your baby is latching properly. If breastfeeding hurts beyond the first few days, something's wrong. Get help from a lactation consultant. How do you know if your baby is getting enough milk? Count wet diapers. After the first week, your baby should have at least 6 to 8 wet diapers per day. Count dirty diapers. At least 3 to 4 poopy diapers per day in the first month. Watch for weight gain. Your baby should regain their birth weight by 2 weeks and then gain about an ounce per day. Listen while they nurse. You should hear swallowing sounds. If you're formula feeding, newborns typically eat 1 to 3 ounces per feeding in the first couple of weeks, gradually increasing to 3 to 4 ounces by the end of the first month. Feed every 3 to 4 hours or when the baby shows hunger cues. Follow the formula instructions exactly. Don't dilute it or make it stronger than recommended. How to prepare formula safely. Wash your hands before preparing bottles. Use clean bottles and nipples. You can sterilize them in the dishwasher or by boiling. Use the correct water. You can use tap water if your water supply is safe, or bottled water. Boil water for babies under 3 months if you're concerned about water quality. Mix the formula according to package directions. Use prepared formula within 2 hours or refrigerate it and use within 24 hours. Burping your baby. Whether you're breastfeeding or formula feeding, burp your baby during and after feedings to release trapped air. Hold your baby upright against your chest and gently pat or rub their back. Or sit them on your lap, supporting their chest and head with one hand and pat their back with the other. Some babies burp easily. Some don't burp much at all. Both are normal. Spitting up versus vomiting. Spitting up is common. It's when a small amount of milk comes back up after feeding. It's not forceful, and the baby doesn't seem distressed. This is normal and usually improves as the baby's digestive system matures. Vomiting is more forceful. The milk shoots out, sometimes several inches. If your baby is projectile vomiting frequently, call your pediatrician. You're going to change a lot of diapers. 8 to 12 per day in the first month. How to change a diaper. Gather your supplies first. Clean diaper, wipes, diaper cream if needed. Lay your baby on a changing pad or clean surface. Never leave them unattended, even for a second. Babies can roll off surfaces faster than you think. Open the dirty diaper. Use the front part to wipe away as much poop as you can. Use wipes to clean thoroughly. For girls, wipe front to back to prevent infection. For boys, point the penis down before closing the diaper to prevent leaks. Apply diaper cream if there's any redness or irritation. Slide the clean diaper under the baby's bottom, bring the front up, and fasten the tabs snugly but not too tight. What poop is normal? In the first few days, your baby will pass meconium, which is thick, sticky, and dark green or black. This is what was in their intestines before birth. After a few days, the poop transitions to a greenish brown, then to yellow. Breastfed baby poop is usually mustard yellow, seedy, and loose. It can happen after every feeding or just once every few days. Both are normal. Formula-fed baby poop is tan or brown, thicker, and more formed, usually once or twice a day. Diaper rash. Most babies get diaper rash at some point. It's caused by prolonged contact with wetness or poop. To prevent it, change diapers frequently. Let the baby's bottom air dry before putting on a new diaper, and use a thick barrier cream like zinc oxide. If the rash is severe, bright red, or has blisters, call your pediatrician. It might be a yeast infection that needs treatment. Umbilical cord care. Your baby's umbilical cord stump will dry up and fall off within 1 to 3 weeks. Keep it clean and dry. Fold the diaper down so it doesn't cover the stump. You don't need to apply alcohol or anything else to it. Just leave it alone and let it fall off naturally. Call your pediatrician if the area around the stump is red, swollen, or oozing, or if it smells bad. These could be signs of infection. Newborns sleep a lot, but not in the way you might hope. How much do newborns sleep? Newborns sleep about 16 to 17 hours per day, but they wake up every 2 to 3 hours to eat. So you're not getting long stretches of sleep. You're getting a lot of short naps between feedings. This is normal, and it's temporary. By around 3 months, most babies start sleeping for longer stretches at night. Safe sleep guidelines. This is critical. Always follow safe sleep practices to reduce the risk of SIDS, sudden infant death syndrome. Back to sleep. Always place your baby on their back to sleep for every sleep, never on their stomach or side. Firm sleep surface. Use a firm mattress in a crib or bassinet. No soft surfaces like couches, armchairs, or adult beds. Empty crib. No blankets, pillows, stuffed animals, or bumper pads. Just the baby and a fitted sheet. Room sharing without bed sharing. Keep the baby's crib in your room for the first 6 months, but don't sleep with the baby in your bed. No overheating. Dress the baby in light sleep clothing. The room should be comfortable, around 68 to 72 degrees Fahrenheit. Swaddling. Many newborns sleep better when swaddled because it mimics the snugness of the womb. Use a thin blanket or a swaddle sack. Make sure the baby's hips can move and their face is uncovered. Stop swaddling once the baby can roll over, usually around 2 to 4 months. Day-night confusion. Newborns don't know the difference between day and night. They've been in darkness for 9 months. To help them learn, during the day, keep the house bright and noisy. Don't worry about tiptoeing around. At night, keep things dark, quiet, and boring. No playing or stimulation during night feedings. This helps them gradually understand that nighttime is for sleeping. How to soothe a crying baby. All babies cry. It's their only way to communicate. But sometimes it feels like nothing works. Try the 5 S's, developed by Dr. Harvey Karp. Swaddle, wrap the baby snugly. Side or stomach position. Hold the baby on their side or stomach, but always put them down to sleep on their back. Shush. Make a loud shushing sound close to their ear. Swing. Gentle rhythmic movement. Suck. Offer a pacifier, breast, or clean finger to suck on. These techniques activate the calming reflex in babies. With my first baby, the shushing and swaying combo worked every time. With my second, only the pacifier worked. Every baby is different. Newborns don't need baths every day. In fact, bathing too often can dry out their sensitive skin. How often should you bathe your newborn? 2 to 3 times per week is enough. Until the umbilical cord falls off, give sponge baths only. After the cord falls off, you can give real baths. How to give a sponge bath. Gather supplies: a basin of warm water, mild baby soap, washcloths, a towel, and a clean diaper and clothes. Lay your baby on a soft surface, like a changing pad on the floor or a bed. Keep your baby covered with a towel and uncover only the area you're washing. Start with the face, using just water, no soap. Then wash the rest of the body with a soapy washcloth and rinse with a clean, damp cloth. Wash the diaper area last. Pat dry and dress the baby quickly so they don't get cold. How to give a real bath. Use a baby bathtub or a clean sink. Fill it with just 2 to 3 inches of warm water. Test the water temperature with your elbow or wrist. It should feel warm, not hot. Support the baby's head and neck with one hand at all times. Never leave them unattended, even for a second. Wash their face first with just water, then use a small amount of mild baby soap on their body and hair. Rinse thoroughly and lift them out carefully. Wrap them immediately in a towel. My first baby screamed through every bath for the first month. It was stressful, but I kept baths quick and warm, and by 6 weeks, she started tolerating them better. If your baby hates baths, you're not doing anything wrong. Some babies just don't like them at first. This is one of the most important sections because knowing when to worry can save your baby's life. Call your pediatrician immediately if your baby has a fever. For babies under 3 months, a rectal temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius or higher is a medical emergency. Call your doctor or go to the ER immediately. Fever in young babies can indicate a serious infection. Your baby is lethargic or hard to wake. Newborns sleep a lot, but they should wake up for feedings. If your baby won't wake up or is unusually floppy and unresponsive, call your doctor. Your baby is refusing to eat or hasn't eaten in more than 4 to 5 hours. Missing one feeding can be okay, but missing multiple feedings is concerning. Your baby has fewer than 6 wet diapers in 24 hours after the first week. This indicates dehydration. Your baby's soft spot, fontanelle, is sunken. This can also indicate dehydration. Your baby is vomiting forcefully or frequently. A little spit up is fine. Projectile vomiting is not. Your baby has blood in their stool. A tiny streak of blood can happen if your baby is constipated and strains, but more than that needs evaluation. Your baby's skin or eyes are very yellow. Many newborns have mild jaundice, yellowing of the skin, in the first week. But if it's severe, spreading, or getting worse after the first week, call your doctor. Severe jaundice needs treatment to prevent complications. Your baby is breathing abnormally, fast breathing, more than 60 breaths per minute. Grunting with each breath, flaring nostrils, or the chest pulling in with each breath are all signs of respiratory distress. Your baby is turning blue, especially around the lips and face. This is an emergency. Call 911. Your baby has a seizure, stiffening of the body, jerking movements, eyes rolling back. Call 911. Your baby has signs of infection at the umbilical cord site, redness, swelling, pus, or foul smell. Trust your instincts. If something feels wrong, even if you can't articulate exactly what it is, call your pediatrician. They'd rather you call and be reassured than have you wait and something be seriously wrong. I called my pediatrician at least 5 times in the first month with my first baby. They were patient and kind every single time. That's their job. Let me reassure you about some things that are normal but can freak out new parents. Sneezing. Newborns sneeze a lot. It's how they clear their nasal passages. It doesn't mean they're sick. Hiccups. Babies hiccup all the time, even in the womb. It's harmless and will go away on its own. Weird breathing patterns. Newborns sometimes breathe fast, then slow, then pause for a few seconds. This is called periodic breathing, and it's normal. If the pause lasts more than 10 seconds or the baby turns blue, that's not normal. Call your doctor. Startling easily. Babies have a startle reflex. Loud noises or sudden movements make them throw their arms out and look scared. This is normal and will fade by around 3 to 4 months. Crossed eyes. Newborns' eye muscles are still developing. It's normal for their eyes to look crossed or wander occasionally in the first few months. If one eye is constantly turned in or out, mention it to your pediatrician. Peeling skin. It's normal for newborns to have dry, peeling skin, especially on their hands and feet. You don't need to do anything about it. It will resolve on its own. Baby acne. Many babies develop little pimples on their face in the first month. This is caused by maternal hormones and will go away without treatment. Weird poop colors. As I mentioned, newborn poop changes color frequently. Yellow, green, brown, tan are all normal. Red or black poop after the first few days of meconium is not normal and needs evaluation. Crying for no apparent reason. Sometimes babies cry even though they're fed, changed, and comfortable. This is frustrating but normal. Some babies have a fussy period in the evening where they cry for an hour or two. It peaks around 6 weeks and improves by 3 months. If your baby cries inconsolably for hours every day, talk to your pediatrician. It might be colic or reflux. Here's what I want you to remember. Taking care of a newborn is hard. You're going to feel overwhelmed, exhausted, and unsure of yourself. That's normal. But you're going to figure it out. Babies are more resilient than you think, and you're more capable than you think. The basics are simple. Feed your baby every 2 to 3 hours. Change their diaper frequently. Put them to sleep on their back in a safe sleep space. Give them sponge baths until the cord falls off, then real baths 2 to 3 times a week. Watch for warning signs and call your doctor when needed. Everything else, you'll learn as you go. You'll figure out what your baby's cries mean. You'll find the soothing techniques that work for them. You'll develop your own routine. And please be kind to yourself. You're not supposed to know everything on day 1. Parenting is a learn-as-you-go experience for everyone. Ask for help when you need it. Call your pediatrician with questions. Lean on your partner, your family, your friends. This first month is survival mode. Just focus on meeting your baby's basic needs and taking care of yourself. It gets easier, I promise. By 3 months, you'll feel more confident. By 6 months, you'll be a pro. And one day, you'll look back at these early days and realize you did it. You kept a tiny human alive and thriving. That's pretty incredible. If this video helped you feel more prepared, hit that subscribe button. And drop a comment. What's your biggest question or fear about taking care of a newborn? Let's help each other out. You've got this. You're going to be an amazing parent. I'll see you in the next one.